Cardiac death. So what is the definition of sudden cardiac death? It refers to a sudden or unexpected death that occurs within 1 hour after symptoms which is mainly caused by or documented or presumed cardiac cause is considered to be the sudden cardiac death. And what is the epidemiology of sudden cardiac death? It may be the first manifestation of ischemic heart disease. And one important figures, and if you see approximate figures over here, approximately 70% of sudden natural deaths have a cardiac cause, and 80% of them are attributed to chronic ischemic heart disease. So 70% of all natural deaths are because of cardiac cause, and out of which 80% are mainly because of chronic ischemic heart diseases. And what are the risk factors? Ischemic heart disease is considered to be the most common and the most important risk factor for the sudden cardiac death, and this is the MCQ question. And other factors are considered to be the precipitating factors along with ischemic heart disease. These precipitating factors include obesity, glucose intolerance, hyperlipidemia, left ventricular hypertrophy, hypertension, smoking, or a recent non-Q wave MI, which is also called as non-ST elevated MI. All these are the precipitating factors may lead to sudden cardiac death. Other than the coronary artery diseases, there are non-coronary artery causes of sudden cardiac death syndrome may also be seen. So, non-coronary artery associated sudden cardiac death which is of cardiac cause is the cardiomyopathy. So, cardiomyopathy is the most common cause of sudden cardiac death which is of cardiac cause, which is of non-ischemic in origin. So, all types of cardiomyopathy may lead to sudden cardiac death. But whenever, if you see the question, what is the most common cause of sudden cardiac death? All over the answer should be ischemic heart diseases or coronary artery diseases. If they talk about what is the most common cause of sudden cardiac death of non-coronary origin, then your answer should be cardiomyopathy. It is the language based question. You have to be very careful when you are selecting the choice. In such cases, in the question, you may also see an option called as ischemic heart disease. But when they specifically ask you the question about non-coronary artery disease, what is the most common cause of sudden cardiac death which is of non-coronary artery in origin, then your answer should be all types of cardiomyopathy, because sometimes they may give you dilated, restrictive, anything, or hypertrophic. So, cardiomyopathy is your answer. Other than the cardiomyopathy, there are other cardiac diseases which may also lead to sudden cardiac death which are of non-coronary artery disease. Example like aortic valve stenosis, which is more commonly seen in elderly, approximately if the age is 70 and above. These are considered to be the most common causes. First is the cardiomyopathy and second is the aortic valve disease, that is aortic valve stenosis. And other least common causes include mitral valve prolapse, cocaine abuse, myocarditis, conduction defects like Wolff-Parkinson-White syndrome, and prolonged QT interval are considered to be the least common causes. If we specifically talk about causes of sudden cardiac death in children, it includes AV stenosis. Remember that whenever they'll ask you the question about what is the most common cause of sudden cardiac death in the children, then your answer should be AV stenosis is the most common cause for sudden cardiac death in the children. And other causes include cardiomyopathies, usually the hypertrophic type of cardiomyopathy, as well as the Wolff-Parkinson-White syndrome. And what is the pathogenesis behind the sudden cardiac death in adults? More commonly, the sudden cardiac death in ischemic heart diseases may be because of a lethal arrhythmia, which is responsible in majority of the cases. And this lethal arrhythmia may be because of ventricular fibrillation. So remember that ventricular fibrillation is considered to be the most common arrhythmia which is responsible for the sudden cardiac death in vast majority of the cases. Along with this, severe atherosclerotic coronary artery disease with a disrupted plaques is present at autopsy. And remember that occlusive coronary artery thrombosis is not present at autopsy in majority of the cases. So this is what we need to know about the sudden cardiac death.